When the COVID-19 pandemic started, health authorities worried that some of us would not be reached by public health interventions. This would be a risk to everyone as the virus keeps spreading. One group they worried about were migrants who might be struggling with understanding health interventions. The key concept here is health literacy, finding relevant information, understanding this information, then evaluating the information and finally applying it to draw the right conclusions. In this study, we focus on the health literacy of migrants. Now, the COVID-19 pandemic was perhaps a bit special in that there was rather too much information available, but this doesn't necessarily make understanding, evaluating and applying it any easier. We conducted a survey among over 2,000 migrants whom we determined could be socioeconomically vulnerable, based on what we knew from previous studies. In this targeted sample, we found that most migrants were well informed about the pandemic. Using an extended index of health literacy, we found a moderate correlation between health literacy and socioeconomic vulnerability. The most vulnerable migrants tended to have more difficulty finding and understanding relevant health information. They also adhered more to unscientific theses that were not part of the official communication, like thinking that drinking hot tea can prevent COVID-19. So yes, there are vulnerable migrants with lower health literacy, but even among the targeted sample, we found many migrants who were just as well informed as the general population. So really, we should not focus on nationality, but dig deeper and consider vulnerability. Some of these can be linked to migration, like having an unstable residence permit.